To diagnose a cyst, there are several techniques a medical professional can carry away, and we're going to explain these today. First, we would have palpation. These are sacs filled with fluid, so it's easy to identify through palpation. This can be an external through the stomach or intravaginally. You can also diagnose cysts with a sonogram, a transvaginal sonogram. The cyst would appear on the ultrasound. It's very important to rule out pregnancy. If the patient is pregnant, the cyst can be formed by the HCG hormone, so it's very important to know if this is the case. Once there is a confirmed diagnosis of cysts, it's very important to do some complementary tests. These would be two mainly. An imaging, so this normal imaging to identify the size and the location of the cyst, and then some blood work to find for a specific marker, the CA125, that can be an indicator that the cyst is a malignant cyst or even a tumor.